Greetings to everyone with us for today's webinar on mobilizing civil society for COVID-19 prevention and vaccination. I am Midori the Habich, and I will be moderating the discussion with our three expert panelists. Thank you to all of them. This webinar is hosted by the USAID Local Health System Sustainability Project, which works to help build sustainable, resilient health systems around the world. Today's webinar, we will examine how collaborating with civil society can strengthen government's COVID-19 response efforts and how they have actually happened in our three experiences that our panelists will share lessons learned about mobilizing communities and civil society organizations. We will be hearing from experiences in Laos, in the Kyrgyz Republic, and Colombia, so from every part of the world. Based on these experiences, we will discuss how civil society engagement can support vaccine acceptance and uptake. And of course, we will also be discussing how these learnings and solutions can help strengthen health systems in the longer run. With a systems perspective, we are very, very interested in learning how different actors in the system interlink, strengthen their collaborations and their abilities to strengthen the health system and support the sustainability in the longer run. So with these opening remarks and welcoming you all again, I will turn it over to Kelly for a very interesting presentation on Laos. Over to you, Kelly.
Great. I'm really excited to share our experience here today. Next slide. First, a little background on our COVID context, specifically how things began. For those unfamiliar, Laos is a landlocked country of about 11 million people. We share land borders with 5 countries, including China, Thailand, and Vietnam. Given those high-risk borders, the national response began in late January. Our Emergency Operations Center activated and quickly ordered screening to begin for international travelers. While our response may have began early, the first 2 cases in Laos were not identified until the 24th of March. As you might expect, this made for a very uneasy March. Each day that we did not confirm a case strained public trust in the government, one not previously known for transparency. Fake news raced across social media, including reports of mass deaths in remote areas, and the enormity of the need to respond became apparent. The government's response, however, shined. It was highly coordinated, as health leadership quickly recognized how important public trust would be to get everyone to implement measures such as social distancing and comply with lockdown. Schools and entertainment venues closed even before our first cases were identified, as regional borders sealed and flights dried up. Into this context, USAID and the Ministry of Health requested LHSS to play a pivotal role in the response, which lasted from March to September 2020. Next slide, please. The LHSS activity in Laos consisted of 3 key areas. Engagement of civil societies, organizations was explicit in Focus 3, but also a modality across all of the response. Our infection prevention response consisted of enhanced border screening and support for ad hoc quarantine centers, public environmental sanitation promotion, and promoting personal action in home and business. We worked on risk communication, strengthening a national telephone hotline to handle an unprecedented surge, as well as partnering with the ministry's communication unit as they experienced their first online health emergency. Our third component asked private pharmacies to do risk communication and refer suspect cases, and explicitly sought to engage civil society to prevent the spread of COVID. Next slide, please. What I want to explain today is what we learned about the value of a civil society network. LHSS leveraged a non-governmental network called SunCSA, retooled it from nutrition to address the pandemic. For those who haven't heard of it before, SunCSA is a global initiative linking organizations that wish to improve nutrition. CSAs exist in many countries around the world. In Laos, members include groups like Lao Disabled People's Association and the Association for People Living with HIV/AIDS, as well as international non-governmental organizations such as Save the Children. CSOs are a trusted source of information in the communities that they serve, and staffers immediately wanted to contribute to the national response. Now, normally education and engagement is a face-to-face activity here in Laos, but with a lockdown for April, we had to find a way. Sun CSA members decided to act with LHSS. Our first step was we flashed members to join a WhatsApp group to coordinate. In 2 days, we had over 100 community development workers and 32 organizations signed up to work together. We began circulating graphics and guidance as we could get a hold of it. We worked together to clarify translation from English, and with a dedicated LHSS team member moderating the group, information requests were quickly answered, and we saw how important it was to have a forum where people could discuss what they were seeing across the country and help people get the information they needed. These same community development workers, locked out of their offices, were left without Wi-Fi for the most part, and quickly ate through their savings on mobile data. LHSS responded by buying phone credit to keep the network flowing. We quickly expanded online communication to weekly Zoom hangouts, a first for almost everyone, where we asked CSO network members to share what they were doing as lockdown ended. One talked about setting up tippy taps, another about how to reach village health volunteers with masks. As the country tried to find a new normal, CSOs spread out to schools, bus stations, village meetings, and health posts to share the information they'd learned through the network. Our online sharing was so successful, the group ended up expanding to include national UN staff and some local government officials. We were supplying up-to-date information and provided a critical service by being on hand to explain and discuss, not simply broadcast. We learned that the use of an existing network, one that came with established relationships plus known and trusted reach into marginalized communities, provided an excellent opportunity for rapid mobilization. The network engaged in online platforms while also returning to traditional in-community actions, not just a top-down approach, but a dynamic bottom-up and lateral real-time technique. Being an existing network also meant we quickly established a good partnership with the health ministry and the national response, because weeks before we had been working with those same people on nutrition programs. Next slide, please. I'd like to reflect on the lessons of our response. While we were very much flying blind in those initial days, the urgency quickly turned into recognition that we found a highly functional platform to enhance the response. Now, in recent weeks, vaccination has begun in Laos. We're at about 40,000 doses, and we're still reflecting and using those lessons a year later. One key one of those was that we realized CSOs are ready and willing to have their own staff members to extend local health departments or the local governor's office as needed by functioning as a surge workforce. But the much more complicated and yet more crucial role is to have CSOs engage in public education. CSOs are essential for risk communication by sharing information in remote areas with language minorities where mass media doesn't work, by providing a non-governmental social listening service, hearing about rumors and relaying misunderstandings and misgivings, using our clout to get people heard. And of course, clarifying, explaining, and answering questions to make sure that people get thoughtful, real answers, thus providing what we need to stop vaccine hesitancy. Next slide, please. So some key takeaways. The process to leverage implementation from support for CSOs was less bureaucratic than we thought it would be. We enjoyed that there was a strong sense in Lao that we were all on the same side. Our nutrition relationships quickly turned into COVID relationships. By lucking out into a multi-sectoral CSO network, we broke out of a health silo that would have limited our areas of operations and our impact. The Ministry of Health, being appreciative of our inputs and saying the value of our organization, supported our involvement rather than being reluctant to let us in. And it turned out this paid great dividends. Laos to date has just 49 confirmed COVID cases, and most of those were identified in quarantine centers. While our country remains effectively sealed, we count ourselves incredibly lucky. This remarkable status owes much to how the Lao people themselves, both independently and as part of civil society, rose to this unprecedented challenge. We're very proud of how these activities reached those who otherwise would have been last, and saw the value in using solidarity approaches to spread across communities. A year on, civil society organizations from our network report even greater linkages with the health system and their local leaders, with a strong sense of shared national pride. Thank you. Back to you, Midori.
Thank you so much, Kelly. That was really a great presentation. You pointed out the importance of trust between the civil society actors and the public sector, trust within communities and CSOs. And I'm sure we'll be talking more about this essential element of trust in communications. As you say, I really like your phrase, listen, explain, and discuss, not only broadcast. So with that, I would like to turn it over to Ida. Over to you, Ida.
Thank you very much, Midori. I'm so glad the concept of trust has already come up, because for us at Internews, it's absolutely key. You can go to the next slide, Midori. And I would like to talk about, first, just to mention that for those who don't know, Internews is the key communications partner in the local health system sustainability project. So we get involved when it is accurate information and more effective communication that would make a difference, and that would help people make better decisions for their health and wellness and well-being as well. So I'd like to first give you an overview of our approaches in settings around the globe where it is a lack of information or misinformation, or even an overabundance of information, as we've seen with COVID-19, is the problem. Trust is central to our work, and when we work to correct misinformation and make meaning of information, it ensures that this information can be put to use in people's lives by listening to trusted sources. So how do we establish where trust comes from? We do this when we can by conducting an information ecosystem assessment. This means that we take a deeper look at the information ecology and check where this trust sits and also how it flows. We also have a rumor tracking methodology which keeps being honed through our various crisis responses around the world. And through the stories that our journalist partners do, we're able to amplify grassroots voices and shape village conversations or district conversation, and in the process also national conversations, which can in the process influence policy. So you can go to the next slide, because I'd like to present two case studies. They're examples in two settings where this approach, where I'd like to give you a glimpse into where this approach has helped address some of those information and misinformation type challenges. Go to the next slide, please. So the first is Kyrgyz Republic. In the previous slide, I showed the context because we may not all have been there or know where it is. It's in Central Asia, and it borders China, and it's amongst the poorest of the former Balkan states. So while we know that CSOs are a trusted source of information, it is incredibly important to know, which CSOs are the trusted sources of information. So that's where our information ecosystem helped. And COVID-19 poses communications challenges to governments anywhere in the world, including combating misinformation, as we've said. But in Kyrgyz Republic, there were certainly compounding factors, and that was timing. The political challenges you see on the screen meant it was invaluable to our response that we knew who those trusted CSOs were, who the community was that we needed to mobilize, because the timing issues, the political problems described on the screen in itself led to an information vacuum. And our data collection told us that in addition, people perceived COVID-19 information, the information that was there, to not necessarily be of relevance to their lives. They knew of unexplained deaths, but our work helped to connect those dots, to help people have an aha moment and understand what all those unexplained deaths actually meant. Please go to the next slide. This image is a scene from a very powerful video we produced with partners in Kyrgyz Republic. It's titled, "Take Care of Your Loved Ones." And it's crafted to appeal to a rural audience by appealing to the Kyrgyz culture of respect over centuries. So the expert civil society community we engaged for the crafting of messages and materials guided us, for instance, about the fact that in rural Kyrgyz society, a greeting always ends with wishing long life and good health to your loved ones. So this simple theme is clearly appropriate to COVID safety, and hence the video's appeal. It's really beautiful. I hope you'll have a chance to have a look at it. Through these insights from deep listening, we were able to then advise the Ministry of Health on their additional communication initiatives about how the tone and the approach and the type of storytelling that would be impactful needs to be crafted to appeal to different audiences. So you can go to the next slide, because there was a very different audience we absolutely had to appeal to. As you can see from the demographics there, the youth is an incredibly important audience, an incredibly large percentage of the overall population in Kyrgyz Republic. So what does the youth do? They listen to social media, they contribute to social media, they find social media influencers are their trusted voices. So again, that's where our information ecosystem and our knowledge of civil society helped us craft these approaches. So in social media discussion monitoring, very quickly it was picked up, or up to date, at least 20 cases of misinformation on vaccines have been addressed by fact checkers. And through these channels, including the 19 state-run TV channels, we're able to correct misinformation via, and also via social media. So again, the listening helped us to know what the major public dialogues were and to then integrate them into the content which our partners produced. And then again, as I said, broadcast on these TV channels. As you can see, they're vital platforms for reaching children and the youth. You will see Santa in there. Santa has to wear a mask. Santa can fall ill. And the celebrities I mentioned, it's really made for very impactful programming. You can go to the next slide so that I can take us quickly around the world, across the world, actually more than an ocean apart, but the same principles apply to Colombia, where it's important to listen to affected communities for cues on how to address misinformation in that community. You can go to the next slide. So again, there were challenges. We worked, I would like to highlight two of the territories in which we are working in Colombia. One, the Wayu indigenous community, they live in an area which is arid and where resources are scarce, and where again tradition is very important. In the capital, there was potential that existing conflicts or xenophobia would be exacerbated by COVID-19 realities and of course COVID-19 misinformation. So again, community engagement showed us that there's no one-size-fits-all approach. These are very different communities, so we needed to craft very different information and communication responses. Please go to the next slide. So to hone in more deeply and meaningfully into what that would be, we did an information, we are busy with an ongoing information needs assessment, which would then, of course, determine how, the best crafted, how to best craft an appropriate response. Already with this information needs assessment and the other deep listening that we do, which is something we do wherever we work, it was clear that there were rumors and misinformation around vaccination. And our approaches, our rumor tracking approach I mentioned earlier, helped us also to, of course, not just track rumor, but then respond to rumor via trusted sources, and then to have that response to the rumor be present on the most trusted sources of information, like I've mentioned before. You can go to the to the next slide. This is a picture from a funeral with physical distancing in place, which is something that was not known to this community, but through our communication efforts, this came to be adopted. So obviously very important for COVID safety. Again, whatever insight we gleaned, we're able to share with the help with the government, and so that it ultimately contributes to the strengthening of the health system. We say when the information network is strengthened, the health system itself is strengthened because it forms a part of the health system, of course. So I'll go to the takeaway points. Just to say that it's just so clear that without working with trusted sources of information, we wouldn't have been able to reach target communities in target formats that they would most relate to. We know that COVID-19 poses communication challenges to governments around the world in combating misinformation and reaching specific audiences. But in these two settings, we believe we helped those governments kind of address them in ways that would really stick and would be relatable for people who live there. For the long haul, what's incredibly important is that we feel that, of course, for the immediate year or two, it's important to be able to address vaccine-related misinformation. And for the long haul, this linked in work with civil society and being able to transmit this to the government of Colombia, we believe that our approach will also, in fact, contribute to pandemic preparedness when there is, if there should be a next pathogen, these approaches will already have been embedded in the response in the health system. So I think I'll end there and look forward to questions later. Thank you.
Thank you so much, Ida. Thank you so much, Ida. That was a wonderful opportunity to hear about concrete approaches that and tools that allow us to this very important condition and tool, which is deep listening to the voices of the communities. Start by listening, and that, I think, contributes enormously to building trust, to be able to, in an effective way, establish a dialogue and understand that communication is not just passing along some messages, but understanding the two-way communication. So thank you for that, Ida. And now I'm very pleased to pass the floor to Matt, who will be talking to us about the vision of USAID and how for health system strengthening and how community and engagement of civil societies play a crucial role. Over to you, Matt.
Thanks, Midori. Hello, everyone. Good morning, good afternoon, good evening. Those were great presentations. Thanks, Kelly and Anita, for sharing the country examples. And thanks, LHSS Project, for convening, running this webinar. With my limited time, as Midori mentioned, I'm going to talk broadly about the upcoming launch of USAID's Vision for Health System Strengthening 2030. How that vision emphasizes the role of civil society, and in doing this, I hope to pull together some of what we just heard into a few common threads. Next slide. So here we are, over a year into the COVID-19 pandemic and the subsequent impacts, and we're all now well acquainted with the ongoing stress it's placed on health systems across the globe. We've also seen the growing impact of misinformation, as our other presenters just alluded to, associated with the pandemic. COVID-19 has shown the world, not just those of us who work in global health, how fragile many health systems are and how really vital these systems are to the overall success of society. So it's in that context that USAID will be launching the Vision for Health System Strengthening 2030 later this month. While we wait for the official launch, there are some aspects and themes which I am allowed and eager to preview here. So if we look at the first bullet, first and foremost, this vision builds on previous thinking around the well-known health system building blocks, but it also hopes to shift focus more towards the outcomes that we're trying to achieve within the health system. And this is how we arrive at these outcome goals of equity, quality, and resource optimization. Systems thinking and systems practice are elevated throughout the document as we think about how to tackle problems with an integrated approach at all times. High-performing health systems, the bullet here refers to a framework and tool the office has developed, really a way of thinking. This tool assesses the perceived level of health system functionality across 4 domains: accountability, affordability, accessibility, and reliability. By understanding the strengths and weaknesses of healthcare processes in a given context, we're able to make recommendations around improved management, policy, programs, research, etc. And then the last bullet on this slide refers to cross-cutting themes, which we also think of as approaches as they're laid out in the vision. I'm going to go into these cross-cutting themes a little bit more on the following slide and talk about how we hope to enable civil society and CSOs specifically through these. Next slide. So here in the overarching bullets, you have our cross-cutting themes, and underneath of them is some of how we hope to enable civil society. So when we talk about facilitating transition to local partners, I think this refers less to handoffs at a national level, but more rather, how do we do a better job of working with communities and local organizations to take on larger leadership roles? This often requires specific understanding and framing of the roles civil society plays, supporting existing CSO networks and structures, like what Kelly mentioned earlier, is vital to doing this. This is also something the Office of Health Systems is engaging in directly through efforts like the Integrated Community Health Collaboration, where we partner with UNICEF and Bill and Melinda Gates Foundation. Supporting partners is not only an objective, but it's also a means of implementation. USAID broadly as an agency increasingly seeks to implement programs through efforts like these, being very particular about who to engage with, and efforts like the New Partner Initiative shows how deliberate the agency's being there. When we talk about enabling support, enabling and supporting social and behavior change, we think of behavior change not only as the adoption of healthy behaviors by clients, but also as an effort around provider behavior. CSOs play a vital role in enabling such change by promoting policy, support to health workers, the community level, and also advancing learning, training efforts, among many other types of support. This is also where we focus on social accountability efforts designed to raise citizen voice, promote collective action, and bring accountability more broadly into the health system overall. And this last bullet, supporting linkages among communities and public and private sectors, underlying the high-performing health systems framework I mentioned earlier is the need to be responsive to the preferences of people, the people that we hope to work with and partner with. This is especially crucial, something like a vaccination campaign, which I'm going to talk more about in a moment. And CSOs are, of course, vital in supporting these linkages, and often are then they themselves the links. Next slide. So I'm going to move back from broad USAID support for civil society and CSOs here and talk a little bit more about how this links with the valuable support CSOs are able to provide around vaccination campaigns. So demand generation and acceptance, I think if we think of the two previous presentations, one word that sort of stood out for me is trust. And I think a lot about how CSOs are able to foster this trust in both being part of the community, but also working as a channel between government, public, and private sector. So when these linkages are strong, we have a strong, responsive health system that can adapt, adjust approaches, identify gaps, and one that will be resilient in times of shock and distress. To add another example quickly from Mali, there's an effort being taken up by the mission there to increase capacity of the national communication lines around vaccine information by adding additional responders. These lines are vital to disseminating accurate information, which is great, but they're also gathering data on rumors coming in, which is a lot like what Ida was talking about in Colombia. This USAID is supporting the Ministry of Health to help with rumor analysis and identify specific gaps. So just another example there. I'm going to quickly move through the last bullet so that we can go on to the Q&A. Equitable access and delivery of services. Here I want to highlight the role that CSOs play in providing voice to marginalized communities. Communities who might not be initially covered due to various societal and physical barriers. It can improve access, address language barriers, reduce stigma, of course, etc. We have a vaccine that needs to be distributed to as many people as quickly as possible. Maintaining equity is going to be a challenge, and one where CSO support is vital. Finally, on quality and safety, as we know, quality needs to keep pace with access, and CSOs play a role in ensuring the proper handling of vaccines, tracking negative reactions, reporting, ensuring proper safety protocol is met. So as I mentioned earlier, CSOs assist with workforce education around vaccine distribution. Again, pointing to those necessary linkages need to be made. All right, next slide. So lastly, I'd just like to close with a quote that I think sort of summarizes a lot of what we heard well. Dr. Moetti from WHO says that vaccines are our best hope of ending this pandemic. While the efforts being made for successful immunization campaigns are critical, without community support, they can easily flounder. And I would add in many cases, they will flounder without this kind of support. So that ends my remarks. Back to you, Midori.
Thank you so much, Matt. As you were explaining the new vision, I was thinking of the importance of documenting these experiences, the ones that we've heard about, and many others that might be happening around the world, to better understand how to build trust, which are the enablers and barriers for civil society engagement, how to use approaches for deep listening. Thank you again, Matt, for that great presentation. Now, I would like to turn to the question and answer portion of our webinar. We have already very interesting questions, and I will just start by posing a question for Kelly and Ida. Could you please reflect upon your understanding of government, Ministry of Health reaction to a civil society engagement in terms of the initial stages? What were the facilitators to gaining trust within government for CSO involvement and engagement? Over to you, Kelly.
Thanks, Midori. To be very candid, we were very concerned how the Ministry of Health would accept a CSO partnership. Some actors in the government are more open and some are not. However, because we engaged as Sun CSA, which is a known quantity, an existing network that has annual meetings with the ministry and joint programs at times, we had a huge advantage in starting a working relationship on a good note with a lot of trust. As soon as it became clear that we were willing to take our instructions from the ministry and respond to areas of need that they identified and asked for help, our relationship strengthened immensely. As we went, we just made sure that we continued to have a dialogue. We reported back a lot what we were up to. We didn't necessarily ask permission, but we kept them informed. And that turned into a great relationship that turned into, in the end, the ministry offering to provide training for the CSOs, which is a total inverse of the normal relationship. Maybe Ida can share more lessons from there.
Yes, I will. I mean, as I mentioned, in Kyrgyz Republic, there was political turmoil. The country was actually in a period of transition. So it was really vital that we engage with civil society. The vacuum that I described exists not only in the information space, but also in government and in governance. So in the end, I described those state TV channels and those other platforms that we work with. That is a form of engaging with government. And we also engaged really closely with the Ministry of Health, who were really thankful for the insights that we could, with which we could provide them. That's on the sort of learning side for the government. And then on the communication side, the fact that those TV channels existed, state channels existed, and that we were able to provide and produce content for those channels, that content that was clearly vital, was something that the government was really thankful for. I see there was a question asking how long we had worked there and how we were able to build this trust. We have been in Kyrgyz Republic for the past 25 years, which obviously contributes to this deepened trust relationship. In Colombia, again, you saw the challenges. I mean, the challenges in the rural areas, but specifically around xenophobia and migrant issues. the absorption of migrants into the health system is a critical problem that the health system in Colombia is dealing with. And our deep listening insights, from the information needs assessment I described, actually, in fact, helped us even pass on some of the information on to those further actors in the LHSS response in terms of the insights that we gleaned from migrants themselves about what would, what actions would best benefit them in terms of absorption into the health system. So I think that was a vital information connection point.
Thank you. I have a very interesting question here from Matt, so I'll just read it out to you. We've learned that emergencies and crises often provide opportunities to respond and engage in ways we might not otherwise. Could you please share USAID vision on what specific action or approaches have been most helpful to strengthen public government and CSO relationships in these irregular times and in the regular times as well?
Yeah, so I think most of what we focus on is working directly to create the enabling environment to strengthen those relationships. I don't know that it would be specific to the times, but working to improve policy so that it's more open to and responsive to the civil society organizations, I think is one really key area where we do this. I wouldn't maybe say more than that right now, but that's sort of my first thought on that.
Thanks, Matt. Lots to think about on civil society engagement and how to be effective in doing that. For Kelly, one of our participants says that in Laos, the sustainability of the CSO involvement in public health efforts has been tenuous in the past, and not only for COVID, but also for HIV, for example. It would be great if the Ministry of Health and the government of Laos harnesses this important resource. How is government approaching sustainable financing of CSOs in health? Do you have any experiences that you might share with us? For example, social contracting. Perhaps the pandemic health emergency has led to further thinking on this field.
What a great question. I first admit that I don't know as much about HIV/AIDS financing, but I do know that there's been some innovations with involving local civil society, what are usually called NPAs in Laos, around the Global Fund. And I think that's been a very important way to demonstrate to the ministry the value that local organizations bring to the table. Beyond that, most local organizations seek out funding from overseas development opportunities much similar to international organizations, or seek to partner on larger projects with international organizations that are seeking funding. I'm not aware of any social contracting that exists, and I don't think that the ministry at this time is seeing that they have a role in ensuring civil society is financed. But we, as for example, as a network, Sun CSA, and some of the other CSO networks that are non-sectoral, have seen that our role in Laos is to grow the space for civil society, and that includes advocating with donors and identifying opportunities and playing matchmakers to get smaller organizations that may not have the kind of networks that others enjoy to connect with good opportunities. Just this week, I took a call with a private donor who was looking for a good fit to fund some food security support during the COVID economic crisis. And I think that those kinds of opportunities will continue if we can maintain a network that can act as matchmaker.
Thank you, Kelly. I think this is a great point. I mean, looking into how to provide access to resources, needed resources for CSOs, involvement and community engagement is a key element that maybe we could think more about, and how that can be a sustainable financing and not just in times of a crisis or emergencies. So I have an interesting question for Ida as well. can you comment on how you coordinated this work with governments, feeding back information and rumors, and how best to message to different communities? So that's a really broad question, Ida.
Sure. Okay. So obviously, you may know that in Kyrgyz Republic, our work is further along the way. So what we did, for instance, is we helped the Ministry of Healthcare to improve their skills in public communication. So that's a skill that we have. That's a capacity building skill that we were able to pass on. And then we also served as a bridge between this ministry, which is responsible for COVID-19, for the response, and of course also for messaging, to build a bridge between this community and independent media outlets. As you see, there are many state channels, but there are also independent outlets to which the ministry had not really been well connected. A further area of help was in terms of speech writing and public speaking, the management of information, which are areas of our expertise, and which were clearly, given the governance gap that there had been, urgently required in Kyrgyz Republic. It's not something we typically do, but it was an emergency measure which was vital, and we did it.
Great, thank you so much. Ida, I would like to turn to Matt now for some specific questions that are coming in for you. For example, has USAID advised countries to include health system funding in the proposals to the Global Fund, COVID response mechanisms? And going beyond that, how is USAID ensuring that this health system lens is being applied when we're talking about the rollout of vaccines, the response, emergency response in general? It's not frequent that it's always a health system lens that is applied to these interventions. So I'd really like to hear from you about this.
Yeah, so that is really the $3.5 billion question. I'm going to tell you my answer is going to be unsatisfying. I think we're in the very early days of this, and trying to speculate exactly how that's going to be done and what's going to be done is, it's just, I think it's too early to be able to say that. And I mean, this is a question that we are all asking each other as well. I think in terms of how we bring a health systems focus or ensure a health systems focus is, I mean, we all sort of play a different role in this, but I think it's important to have conversations like the one we're having right now, promoting the importance of health systems in vaccination campaigns, distributions, efforts related to the pandemic, as clearly and as often as possible to the right people who need to hear it. So I think that's something that we're going to continue to work on, at least from our office and global health. But yeah, so that's my response to that.
Thanks, Matt. So for Kelly and Ida, how do you systematize and disseminate the experiences in your countries, in Kyrgyz Republic and Laos and Colombia? How do you see this dissemination, collection of documenting and disseminating experiences, which would be the best way forward with that?
This applies to Kyrgyz Republic. I'll go if that's okay. It applies to Kyrgyz Republic and to Colombia, but I mean really to wherever we work. I think in terms of systematize, one of our systems that works really well and applies very much around the world to COVID-19 and the information challenges is the deep listening I mentioned, but and rumor tracking, or rumor management as we also call it. there's a system involved in, you could listen and listen forever, but as with any social research, at a certain point, there's a snowball effect. At a certain point, certain trends emerge, and which we then, if you like, systematize or categorize into high risk and less high risk rumors. So for instance, a high risk rumor would be if people believed that vaccination made them ill or didn't work. A lower risk rumor would be that gargling with salt water would prevent COVID-19. It's wrong, but it is, at least gargling with salt water in itself is not harmful. So we would then focus obviously on the high risk rumors and find ways through these trusted sources to correct them. But it is a systematic approach, because first we need to know what those rumors are. We need to have them into categories of both high and low risk. And then, of course, the most prevalent ones are the ones that need to be addressed. Of course, fact correction and the role of fact checkers is very important. But another part of our system really is to, in fact, also do a reality check, not just a fact check, and sort of try to understand, again, through deep listening, why it is that people believe what they believe, even though it might sound outlandish to us who deal with this all the time. People do believe certain things, and it's been so clearly demonstrated throughout the COVID period. And then the further sort of systematization of this approach is to do the fact checking, the reality checking, and then lay it out in a way that's easily digestible for three types of respondents: government respondents, emergency or humanitarian respondents, and of course the media, who are the respondents we work with most closely. In other words, either through collating all of this into a weekly or monthly bulletin, depending on the sort of scale of rumor problem. And so it makes it digestible. It actually has, in the case of community radio, it has community radio stations actually have a piece of paper in their hand from which to reach, sometimes even something to literally disseminate in communities. And in terms of governments, I mean, there are always these community communications working groups whenever this kind of response is called for. So we would share this collated information with corrections also in those working groups, and be part of the process of deciding how to further disseminate this information, and how to, in an iterative way, to keep listening and to keep and to also track for whether that rumor is disappearing, hopefully through our intervention, of course.
Thank you,
I think
Ida.
I have a lot to learn from Ida.
Yeah.
I think the loud
Absolutely.
response it definitely has not as sophisticated as that, but I think we're now starting to learn, as vaccination begins, how to operationalize some of those great lessons.
Yes, and it's very interesting in the case of the work that Ida was describing, that we are, in her experience, she has been working both with rural communities and urban communities. She talked about Bogota in Colombia. And so I would ask, is there a substantial difference in the approach and the application of these approaches and assessments if you're working in the rural area versus working in the urban area?
I think the substantial part would all have to do with, it starts with our what we found right at the beginning with our information ecosystem assessment. I mean, the substantial difference would just be that where is it where each community gets their information, which is the information that they trust, which platforms, which individuals even, and organizations do they trust. So in that sense, there isn't a substantial difference. I mean, of course, the type of people, the sort of categories of people or platforms trusted might vary, as one can predict, from rural to urban, or from from rural to urban communities. I mean, in those rural communities, for instance, in our Colombia work, it's been incredibly important for us to also listen to traditional leaders and to hear what existing messages they had and what advice they had for us in terms of which messages needed to be amplified. And they, of course, themselves are the amplifiers of messages. But no substantial difference in that it just all goes back to what is it that people already trust, and then work with those trusted platforms and even individuals themselves.
Thanks for that. So over to you, Matt. Listening to these wonderful experiences and within the framework of the new vision for health system strengthening, what is it that most excites you about this forthcoming vision, and where do you see more potential for community engagement and civil society in general?
Well, I would go back to sort of the areas I spoke about, those three cross-cutting themes in the presentation. But I think that the high-performing health systems tool and framework is another really exciting area. There was a question also about how this relates to capacity and commitment, and I think I'm excited about how these are all things that we're trying to measure, trying to understand better, and capacity, commitment, affordability, accessibility, all these different domains. And I think that providing sort of a citizen or local voice or opinion or perception of what the health system looks like, I think is a really great way to think about it and start in order to do better work, in order to strengthen the health system. So I guess I'm most excited about that. And I think that promotes these themes that we're talking about. So yeah, I also, I like the focus on outcomes. If anyone's heard anyone from USAID, from our office, talk about health systems, they know that making the shift to what are we trying to change, what impact are we working towards, as opposed to how are we going to put inputs into the system, I think is also really exciting. So yeah, those are the areas I'm most excited about.
Thanks, Matt. Let me turn to another set of questions which I find very interesting, related to health workers. In the case of our country experiences, Kelly, Ida, have you had the opportunity to look at health workers as a group? How was the relationship on the communication between community CSOs and health workers? And of course, have you any concerns regarding the hesitancy that sometimes health workers themselves show towards vaccination going forward?
That's a great question. We are currently seeing here in Laos that a lot of health workers do seem to have some reluctance to vaccinate. It's very preliminary, and of course we don't have a systematic kind of listening approach like Ida described. I think in our case, many people feel it may be due to the origins, because we haven't yet gotten COVAX vaccines, so the vaccines that are currently being rolled out are not yet WHO approved, and so that seems to be an issue. So what we've decided to do as civil society, because we've also heard some of the same questions amongst our own staffers, is to take the same approach we use in LHSS and immediately translate the information to make it accessible to civil society actors, and make sure that we can equip them with the answers to their questions, and then encourage them explicitly to go out and engage with their partners, many of whom work with local healthcare workers at their health centers and local hospitals.
I'll talk about health workers in Kyrgyz Republic, where, as you could see, there's a lot of content production. From documentaries to a TV series, which is currently being filmed. We have engaged healthcare workers in our content production, for example. We regard them as experts. Of course, they're expert community. So there was a category of society we needed to engage in order to get to, both the approaches and the actual content which we put together. So also in terms of our work with media, they speak on various health-related topics. I think you actually mean, do you perhaps mean community healthcare workers as well?
Yeah, that would be another question that we could pose ourselves. Community health workers and health workers within the health system more formally. they are important information sources to communities and people individually and families. So have you ever thought of working with them as a trusted source also?
We absolutely do. I mean, as it happens, not specifically in Kyrgyz Republic and in Colombia, our work is still ongoing. We may consider that, but certainly, for instance, in our Ebola communications response, we worked very closely with community health workers. That was in West Africa, and we certainly have currently have a program in DRC still. And you know, with health emergencies around the world, community health workers really are those foot communicators. You know, they're always regarded as the sort of foot soldiers of health provision, but their even more important role is that of communication, because they need to communicate and correct rumors, for example, and also communicate to people when they need a more robust health response, when they need to go to a clinic or a hospital, for example. We do, when we speak to populations around the world where we work, stress the importance of healthcare workers, obviously.
Very interesting field of work there. And we're very excited to hear what is upcoming in the work in the 3 countries. We do know that there will be ongoing efforts to engage civil society further as we see the vaccine campaigns rolling out. So we will be asking you again to update us on all these experiences. We are now almost ending our webinar. So much to talk about, and I would like just to pose one final question to Matt. After hearing these experiences, do you think that we should be documenting more what's going around in the world with civil society engagement? What advice can you give Kelly, Ida, myself, in terms of collecting more evidence on the effectiveness of civil society engagement?
Yeah, well, absolutely, we could always be documenting more. And this is a difficult thing to document, especially given how truly local many of these organizations are and how context specific it is. We, as part of the launch of the vision, are trying to better understand this, our learning agenda. We are specifically asking, sort of as one of the dimensions of this, what are the effective and sustainable mechanisms or processes to integrate local, community, subnational, and regional voices, priorities, and contributions into our efforts? And I think it's a broad question, but in order to answer that question, we're going to have to understand the role that CSOs play as an equal stakeholder within the health system. So I don't know that gives you a roadmap, but just to say that it is a priority for us, as well as how we do this. So
thank you for that. So as we are ending our webinar, I must say that I really want to thank all of you for your great presentations and insights. This has been really very interesting. And it looks like we're just running out of time. Would just like to say that my own personal takeaways of this webinar are basically one, it seems that engaging civil society is absolutely effective. I get results, and so we should be documenting more. I do think that another takeaway that is important is that we need to build on networks that exist. There's a lot of social capital out there, and it's important to map that social capital and harness it for a stronger health system in our countries. So again, thank you so much to all who joined today, all our participants who submitted such good questions. As you can see, we have not been able to talk about all of them, but I do hope that everybody enjoyed the webinar, and we will be sending out a recording of today's webinar next week. So be sure to watch your email boxes. Thank you again to all. Stay safe and have a great rest of your day. Bye-bye.